Welcome to Medicare for All, presented by SinglePayer Now. Our healthcare system is in terrible shape. That's no secret. Costs are skyrocketing, millions can't afford either healthcare or health insurance, and the insurance industry rakes in billions in profits every year at the same time that they deny coverage to millions. So we ask the question, in the same country that put a man on the moon, why can't we create a healthcare system that works for everybody? And the answer we came up with is, yes, we can. Nobody spends a lot of time thinking about healthcare until they need it. And when you do need it, these are the qualities that you really want in a healthcare system. First, it needs to be affordable. It has to be accessible. It should offer a completely free choice of providers. You really want to have the best possible level of care. And of course, you want to have it cover every type of medical treatment. And finally, there should be absolutely no requirements for eligibility. Now, these are the qualities that are found in Medicare and Medicaid, state access programs, the VA, and other government-funded systems. Meanwhile, the private health care industry has failed miserably in most of these categories, while making ours the most expensive healthcare system in the world. Most people with health insurance don't realize how vulnerable they are until it's too late. In today's economy, everybody's at risk for losing their employment. What do you do about health insurance then? Or your employer buys a cheaper plan or cancels the one in use now, or asks you to pay more of the premiums. What if your insurance claim is denied because of some pre-existing condition you forgot to put in your application? And what if the insurance company decides that the treatment you need to save your life is experimental, so they won't cover it? It happens all the time. Healthcare costs are rising so fast that we won't be able to pay for it in another few years. Over the last 30 years, our gross domestic product, adjusted for inflation, has increased by a factor of 14, while the cost of healthcare has increased by a factor of 33, more than double our GDP increase. Pharmaceuticals are even worse. We now spend 55 times as much as we did in 1970 for drugs alone. At the present rate of growth, our health insurance premiums will actually catch up with family income sometime in the 2020s. So any young adults lucky enough to find a job paying $80,000 in 2024, well, their wages will just about pay for their health care premiums. This is simply crazy. Maybe some of us are satisfied with the insurance coverage that we have. But what about our kids and our grandkids? How will they manage when they grow up? Our national health care budget is enormous. It's now about $2.4 trillion a year, which is about $7,900 per person every year. It's growing exponentially and is doubling every 7 years. But when we compare our cost per capita with those in other capitalist democracies, we find that they are paying a lot less, both per person and as a percentage of GDP. In fact, our per capita costs for health care are 40% higher than any other nation in the world, and 2 or 3 times as high when compared with many industrialized countries. The major difference is that they have national health care systems. Now, do we have the greatest healthcare system in the world? Well, when you look at figures compiled by the World Health Organization, the Centers for Disease Control, and other independent agencies, they tell us that in fact we fall behind a lot of other industrialized countries. We lose more babies. We don't live as long. We don't do as well with many major illnesses. We lose too many patients in the hospital. And we lose so many because they just can't get medical insurance. While it's true that we have terrific doctors and hospitals and equipment, it's also true that many people just can't afford to pay for the care that's available. So they get sicker and they bring down the national average. In the USA, more women die in childbirth than in many other industrialized countries. If they lived in Bosnia, their survival chances would be more than doubled. How sad is that? Here's how the World Health Organization rated the performance of the top 50 countries in the world health-wise. It places the U.S. at number 37, just one above Slovenia for quality of health care, and Cuba is not far behind. Now, of the 36 ranked above us, 30 of them have national health care systems, many of which are a form of single payer. And even with their better health care, these countries manage to keep their medical costs down to between 1/2 to 2/3 of ours. Now, is there any reason why we should not at least be in the top 10 instead of number 37? Maybe it has something to do with how health insurance companies conduct their business. Here's one example. Insurance companies have more than 1,000 excuses for denying your claims. This slide shows just a small sample of the illnesses that could disqualify you from private health insurance. Lack of access to health insurance is a big problem. The people shown here are suffering simply because they cannot afford insurance or their employers can't afford to buy it for them. Now, insurance companies are in the business to make profits for their investors. So why would they want to insure the people who are most likely to cost them money, that is, the ones that get sick? It makes good business sense not to provide care. Small employers often have to make a difficult decision whether to buy insurance for the workers or to keep the business alive. Even if you think you're covered, you can still be financially overwhelmed by high deductibles and copays or low caps. Your claim for services can be denied because you didn't get prior authorization. And if you become seriously ill, well, the insurance company will simply rescind your policy, and now you're uninsurable. Anyway, all these depressing facts simply support my case that the health care system in the U.S. is a disaster, with little chance of getting back on track and getting worse with time. In the U.S., 22,000 people die every year because they can't get access to the health care they need to save their lives. A recent Harvard study showed that number may be closer to 45,000, in fact. Now, naturally, you expect death rates for this reason, for medical reasons, to be higher as people get older. But wait a minute, people over 65 don't have health insurance-related mortality. How can that be? Well, it's because they already have a single-payer system. And that single-payer system is called Medicare. Universal single-payer is a healthcare system that would provide an improved, expanded Medicare for every American. It's improved because it's more cost-effective, and it's expanded, meaning it's more comprehensive coverage and coverage for everyone. So what is single-payer? Well, it just means that the government is the insurer and answers to us, the voters and the taxpayers, not to the investors. Doctors and other health providers will bill the government directly, so there's no patient involvement in billing or collecting at all. Now, since there is only a one payer, there is no need for doctors to pay large clerical staffs to deal with the billing. All doctors and other providers remain in the private sector. They don't become employees of the government. Only the billing and collecting are changed. You're completely free to choose any doctor or other provider in the country. And the treatment decisions are left up to the doctor in consultation with the patient. Government bureaucrats have absolutely no say in your treatment decisions. This is what I mean by comprehensive coverage. The plan covers every aspect of your medical care, including many services that private insurance does not routinely cover.